And generally, how do doctors handle your distress?
Once they hit the 40, you get at least one message every year that this doctor passed away because of cardiac arrest.
What is gut bacteria?
If you look at any patients with anxiety, they will always have gut issues. If you see any patient with gut issues, they will always have anxiety.
So what do you think are the worst foods that parents give to children?
Jigardanda, okay, eat once a month. KFC, eat once a month. Pizza Hut, eat once a month. If you keep on doing the 30 days, there'll be some 30 days.
So what foods actually cause inflammation?
Anything that comes in a package. Or you're veg or non-veg?
Non-vegetarian.
You're non-vegetarian. You're very proud about it. Very veg achi. Non-veg ra.
Your sense of humor is just amazing. What's your view on all these people having 2 a.m. biryani, 3 a.m. biryani? Have you gone to those streets in Annanagar and Mount Road?
One guy was eating the biryani right next to the street vendor. He looked at me and he turned like this. I had a subscriber who took a picture of it and he said that because of you, I'm not eating this at all.
Okay.
And then after sending it, he ate it.
What amount of alcohol is okay?
No amount of alcohol.
Okay.
Close the podcast.
We just finished shooting an amazing podcast with Dr. Paul Manikam. I'm sure each one of you is going to enjoy the podcast just the way me and my entire team enjoyed. Because it's not just super informative, it's also equally fun because the man that he is, he brings every element of information with an amazing fun element with it. So this is going to help you understand more about your own health, how you feel a specific way every day, and how it is directly connected to what you put into your body. I mean, that was a game changer even for all of us when it came to understanding how each emotion is determined by what food goes on the inside. He's also spoken so much about good gut bacteria, bad gut bacteria, what influences the growth of each one. So make sure you make a lot of notes throughout the podcast and implement that. I hope you enjoy the podcast and I'll see you in the next one. Hi, Dr. Paul. Thank you so much for being here. I've been a huge fan of your work, not just the information that you give, which is so valuable for people, but also your sense of humor, which is amazing.
Oh, thank you.
And last time when I had a conversation with you, what was so inspiring for me was your journey from Madurai to California. How did that even start?
It was not a planned one. So in similar to all middle class family, either a doctor or an engineer, that path we took. And then we finished MBBS and PhD in Coimbatore. And at that time, given the financial situation of the family, we decided that, okay, if I have any abroad chances, that will help us settle financially much quicker. So that was the angle that we took. But for me, luckily, my sister was married to my brother-in-law, was a cardiologist in US.
Okay.
Was an internal medicine doctor in the US. So she left to US while I was in my third year of medical college.
Okay.
So then because I had this mind already, so I got instructions from her in terms of how to get into USMLE and all those things. But at that time, they were not giving visas for foreign medical graduates.
Okay.
So then the alternative option was to get a master's degree in some other medical related field. So I applied for master's in public health.
Okay.
That was for 2 years. So I went there, I did my teaching assistantship, research assistantship and all those things to pay for those fees.
Okay.
On the top of it, I need to prepare for my USMLE exams, step 1, step 2, step 3, which are licensing exams before getting an MD degree in the US.
Oh my God. Okay.
Yeah. Those 2 years were my toughest years.
Okay.
Toughest years. I wake up at 7 a.m. I go to the class to study the master from 8 to 3. Then from 3 to 6 would be my teaching assistantship where I teach my undergrad students.
Okay.
And then from 6 p.m. to 1 a.m. would be my preparation for USMLE. medical license.
That was for 2 years.
For 2 years, every day.
Okay.
Every day.
Okay.
And that was new to US, so we need to adapt to that lifestyle as well. But luckily, I got good scores on the USMLE, and then I got into residency in 2008 in Detroit. It's a very good university. But looking back, those 2 years were the fundamental change in my career.
What changed for you then?
Let's say if I didn't get the score, I would have either stayed in my legal career in the US.
Okay.
And then maybe I'm not sure where it would have been taken.
Okay.
And that my MBBS training here in India might have not gotten completely into practice if I would have gone in that route.
Okay.
Or the other option was I have to come back to India and then start training
from the beginning
again. The beginning, from post-graduation. Just the fear of that itself made me do the late nights. Because I was, to be honest, only very good people, very good talented people get postgraduate spots over here.
Okay.
I knew that I was not one of them. I could do hard work, but maybe even putting the hard work, I had a feeling that, okay, this is very competitive.
Okay.
I cannot take the chance.
Okay, got it.
Given my situation at that time. So that's why I went to US. And I was very clear on it. I didn't waste time in preparing for my post-graduation.
Okay.
So my colleagues who were doing post-graduation at the same time as I was trying for USMLE, they finished PG over here and everything. And then they followed the same route over there. And then they came to US after.
Okay, but you had shortened your... okay, that's amazing. Why did you pick gastroenterology? Enterology.
That's why.
Yeah. Oh my God, I think this podcast, though I have so many questions which are going to answer serious problems people have, your sense of humor is just amazing. Why did you pick that?
I should be the only person to pronounce it. Gastroenterology is, okay, so again, I'm just very honest here. Cardiology and gastroenterology are very, very popular fields in the US.
Okay.
Not because that, it is that's the only field that is very attractive. That is the only field with good monetary benefits.
Okay.
And cardiology has been, people are very passionate about it. When I grew up when I was studying medical school over here in India, cardiology is the only specialty that everybody wants to go on. Okay, if you look at it, there'll be so many cardiologists around. There's some passion about it that has been created in the roots of all medical students here in medical college. In my case, I was the same thing as well. Okay, then I actually opted for cardiology. Then I realized that the stressful life of a cardiologist, the risk outweighed the benefits of my passion towards cardiology.
Okay.
So I realized that, okay, I am not the personality to handle like acute stressful situations.
Okay.
So to cite an example, there was a code blue. When we say code blue, which means that the patient is actually dying right in front of you. I was a student. You have to run the code blue, which means that you need to order these people to give the correct medications to make him come back alive again.
Okay.
And all this needs to happen in 2 to 3 minutes. And the patient passed out right in front of me. So I am the leader of that code blue management. So I did everything possible. I gave orders and everything. So finally the patient survived. Okay. After like 3-4 minutes. But those 3-4 minutes, I didn't survive. Okay, I can do this. Kudos to all people who are doing this. Yeah. I can do this. This is so stressful. It may not be suitable for my personality.
Okay.
No matter how much money you give, I can't do this.
Okay.
Then I like procedures.
Okay.
Then gastroenterology was a good hybrid where I can use my medical knowledge with the gut, and also I can do procedures with endoscopy at a much lesser pace.
Okay.
There will be no acute situations like this that often.
Okay.
In gastroenterology.
So the pressure on the doctors is also considerably lesser.
Much less.
Okay, much less.
It's a very good lifestyle where you can have some kind of work-life balance. Cardiology, there is no way.
Okay.
Yeah, you're pretty much committed to the profession.
And generally, how do doctors handle with the stress?
Very bad. Very bad. Did you know that every year the life expectancy of a doctor is decreased significantly, especially in India?
Okay.
And you will, we have like our own WhatsApp groups in among doctors. Once they hit the 40, you get at least one message every year that this doctor passed away because of cardiac arrest.
Oh boy.
In the among my age, you know.
Okay.
So you know all this is not that we don't know.
Yeah.
Yeah, we tell people what to do,
Yeah.
but during that course of time, we lost our path.
Yeah.
And I am talking on behalf of all doctors over here. And it is not an easy profession. It is not an easy profession. And especially in India, the practice is in such a way that you cannot handle work-life balance. It is a bold statement, but I can say that based on how I see people around. Maybe like only 5 to 10% of people may be able to adjust the work-life balance because they are settled. Maybe they have a hospital setting or something like that. If you are a first-generation doctor who is trying to prove yourself that you are successful or you're trying to be successful, there is no way you can maintain the work-life balance unless you are very conscious about it.
Okay. Okay. What is the reason for this? Is it because there are less number of doctors?
The reason is, okay, how do I put this? So the reason is to be financially successful, you need to see more patients.
Okay. Okay.
And the environment has become so competitive to a point that nobody is wanting to miss even a single patient.
Oh, okay.
Okay, I'll tell you an example. My friend who is a very popular ENT surgeon. Okay. And I was at his place. I came from US. I was staying at his place. He got a phone call. He was in the shower. So I took the phone call and I said, it was from one of a new patient. Oh, can I speak to the doctor XYZ? And I said, no, he's in the shower. He'll call him. He came in the middle of the shower. And he said that I'm here. I'll be there in the clinic at 10 a.m. I will come and see you. So don't worry about it. Please come.
Oh, God.
Okay. And I'm not even making it up. This is the common scenario.
Okay.
So because if he says no, then the patient goes to the next clinic.
Okay.
Because not that he's a good doctor or the other person is a good doctor. We need to, the medicine has become such a service providing business to make sure that the client is satisfied to the maximum level, at least in the urban cities.
That's true. That's very true. And with respect to how customer support has been handled in India the last few years, everybody expects utmost best customer service. It comes to, even when it comes to doctors at this point.
Of course.
So you've been practicing in the US for more than 10, 12 years, right? So what I want to ask is, how is the healthcare system different there and here?
It's significantly different.
Okay.
It's significantly different in the terms of, I see only 20 patients a day.
Okay.
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 And each patient I'd be given like 15 minutes. So I start my day at 8 a.m. I finish my around 12. Okay. 8 to 12 is, I see 4 patients in a given hour. So 4 4 are 16. I'm sorry, I see 16 to 20 patients in a half a block.
Okay, got it.
But the remaining half a block, I do procedures.
Oh, okay.
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 So I do see 16, 20 patients a day, but within half a day.
Okay, got it.
Here, they see 12 to 15 patients in an hour.
Oh my God.
In an hour.
Okay.
Because of the requirement.
Oh my God.
You should see a hospital over here if you get a chance. Especially in terms of government access, where there are a lot of patients, less doctors, where you have to see so many patients within the quite period of time. Okay, eventually both of us will end up giving reasonable amount of the same care.
Correct.
But what I spend time on is to protect myself
Exactly.
from any kind of malpractice suit that I might get from that patient in the US. So that translates into me documenting whatever they are saying on an electronic medical record. So in a typical US setting, the clinical experience of a patient would be, you come and you see me, most of the times, all the doctors will be on the computer like this.
Okay.
They will not even see you.
Okay.
They'll say, oh, so your past medical history, past surgical history, what are the medications you're on, what is the problem that you have? You have a heartburn, you have stress, you have thing. Oh, okay. Then why are you not answering? Oh, there's no patient at all.
Oh God. Oh my God.
I am not even kidding. This is what has happened. Most of my time, I'm so glad that I'm good in typewriting. Seriously. So I keep on typing, and then they'll say, oh, okay, so medications have been sent to your pharmacy. You have any questions? We will not let them answer yes. Okay, bye-bye. Only then you'll be able to sustain your work-life balance.
Okay.
Okay, so let's say that I go deep into the patient, say, well, how long you're sleeping? What's your stress level? Then the more that they talk, then I need to complete the chart notes after they leave.
Okay.
That will eat up into my own personal space.
Correct.
And somebody needs to ask the same questions to me a month later.
Oh God. Oh my God. I just love how, your sense of humor is just crazy. So now when you see patients there in India, right? So what is the difference that you see in people who come with gut issues to you?
Every Indian patient that comes to me will have some kind of gut issues.
Okay.
Some kind of gut issue. They may not come for a gut issue.
Okay.
Usually in US, every patient who turns 50 will need to get a screening colonoscopy done.
Okay.
Which means that it's a big tube that they insert into your rectum and then looks into whether you develop any precancerous colon polyps.
Okay.
Because the risk of colon cancer is significantly high in the US, where the government itself said that, okay, if you turn 50, you get a colonoscopy and we will completely cover with insurance. You don't have to pay a penny. So everybody comes after they turn 50. When an Indian patient comes, I can clearly say that they come for a screening colonoscopy, but the second problem will always be bloating, abdominal pain, discomfort, and GI issues all the time. I think what has happened is that when the patient is immigrated from India to the US, within 2 years, the gut bacteria is getting exposed to a different environment where there is significant depletion of the bacteria that they have had while they grew up.
Okay.
If they didn't sustain the same kind of dietary habits, like maybe, including more fibrous foods or their fermented foods like, idli, dosa, and they have introduced themselves to westernized foods like burger, pizza, you could clearly see that the 50% of bacteria is getting depleted to a point that the entire species of bacteria is lost.
Okay.
In this patient where you cannot pass on to the next generation.
It's purely dietary.
It's mainly dietary.
Okay.
Mainly
So before we talk about the gut bacteria, I want to understand what is gut bacteria.
So before we came into the world, before human beings actually came into the world, all these gut bacteria came into the world.
Oh, okay.
Okay, and there's like 100 trillion gut bacteria of this. So we are only in billions. They are in trillions. If you take a tablespoon of your intestinal secretions, there is 500 billion bacteria in that tablespoon of secretions. So, for example, I shook hands with you.
Yeah.
So my bacteria will have been transferred to you.
Okay.
And, getting exposed to all these devices, touching over here. It's like a constant exposure of bacteria into the human body.
Okay.
Through any kind of orifice that they can see.
Okay.
So it is like a fight for real estate.
Okay.
So I want you to picture a newborn baby coming in as if it's a new apartment that is being opened for the gut bacteria to reside.
Wow.
Okay. If it is in T Nagar, of course, it's going to be really expensive. So only high elite bacteria only will come inside. So as soon as the baby is coming out, this gut bacteria is waiting outside, okay, to get in. Even before that, the gut bacteria within the, not the gut bacteria, the commensal bacteria within the vaginal canal
Okay.
while the baby is coming through the vaginal canal out of the delivery, the baby swallows the vaginal secretions, so the gut bacteria is being predominantly from the maternal.
Oh, okay.
So those are all very, very good gut bacteria.
Okay.
Very good gut bacteria. So that looks like a very good basic foundation for that particular baby. So when we are getting exposed to the outside bacteria, this good bacteria will multiply significantly. So it is absolutely important to understand that what kind of bacteria that we are putting in will multiply twice every 30 to 40 minutes.
Okay.
So every gut bacteria multiplies 30 to 40 minutes.
Okay.
Let's say you have bad gut bacteria, that also multiplies.
Okay. So what is a good gut bacteria and a bad gut bacteria?
So all these gut bacteria secretes chemicals at the level of your large intestine.
Okay.
And these chemicals communicate with your brain. And this gut bacteria can control how your brain can actually function.
Wow. Okay.
I'll tell you a very beautiful example.
Yes.
There is a medication called SSRI. It's called Selective Serotonin Reuptake Inhibitor. Basically, what we are saying is that in patients with anxiety and depression, the serotonin levels are very low. Serotonin is a happy hormone. So you are having low serotonin. We will give you serotonin tablets where it will block the uptake of serotonin.
Okay.
Okay, so that is the pharmacotherapy of this. Being a doctor, I will give this SSRI to you so that you have serotonin in your blood. We'll make sure that it doesn't get absorbed properly so that you have a lot of serotonin and then you feel happy.
Okay.
Okay, so that is a tablet. So we give it, the patient takes every night. So in the hope that you increase the serotonin levels in the blood. Okay, the same mechanism of increasing the serotonin in the blood can happen with the gut bacteria. The gut bacteria can secrete the same happy chemical serotonin right at the gut lining, increasing the serotonin concentration in the blood, communicate with your brain to make sure that you're happy.
Oh, that is a correlation between eating the right food and having a good mood.
Yes. Yes.
Okay.
Yes. So that is how powerful gut bacteria is.
Okay.
I can do the exact opposite as well.
Okay.
Okay. If it is a bad gut bacteria, then maybe the chemical that is being set is a dopamine. Okay. Dopamine will also make you happy. But it depends upon what kind of hit that you get.
Okay.
So let's say you eat pizza, burger, or any other ultra processed food, which is high sugar, high fat, which is supposed to make you eat well because of the taste. You eat it, it goes, it doesn't feed the good gut bacteria at all. The bad gut bacteria starts, significantly eating all that and then starts secreting chemical called dopamine right at the lining of the intestine.
Okay.
So this dopamine seeps into the intestinal wall, gets inside the blood and gets connected to the brain, controls your decision-making signals by stimulating more dopamine at that time for you to make it order more pizza.
Oh my God. This is crazy.
So this is how strong the gut bacteria is. If you look at any patients with anxiety, they will always have gut issues. If you see any patient with gut issues, they will always have anxiety or any kind of mental health issues. Both are intertwined. It's like a marriage.
Right.
And the marriage needs to be built in the first 10 years of life.
Okay.
When there is as you talk about in your channel, the foundation happens in the first 10 years. I strongly believe that if we can build a strong foundation of our kids in the first 10 years, the ability to handle the stressful environment when they grow up by doing a YouTube channel.
Oh my God, this is crazy. Okay.
Would be much better.
Wow.
But let's say on the opposite side, you keep on feeding them ultra processed food thinking that chinna paiyan marandaruvan. Kallum karanju poyirum. What will happen is that you are providing an artificial platform for these bad gut bacteria to thrive.
Okay.
and they will not have the mental resilience to handle the stressful episodes down the road.
Oh my God. So what do you think are the worst foods that parents give to children?
There are a lot.
Okay.
Is one. But I think they know, parents will know whether they are giving the right food or not.
Okay.
Okay. And then it comes in, when they are giving the worst food, it comes in two different angles. One is they are so tired that they don't want to make any good food. And, easily available, extended shelf life, ultra processed food is a easy way out. That's number one. Number two, some parents think that, okay, so my kid likes it. I want to see him happy. So I don't want to take the difficult route of, making him cry, eat this and this. So these are the two main things that happens. Anything that is packaged, anything that is refined, anything that is high in sugar, anything that is completely processed, maida is one of the most common things. All this will have a role in modulating the gut bacteria. Doesn't mean that, if you eat one biscuit or one cereal or one burger, one pizza, will that change? Absolutely not. But if you keep repeating it, then that's the problem.
Okay.
That's the problem.
Okay.
And, I used to do my reels on my YouTube by saying that, hey, jigardanda, okay, eat once a month. KFC, eat once a month. Pizza Hut, eat once a month. If you keep on doing the 30 days, there'll be some 30 days. That is how widely prevalent you're getting exposed to all these ultra-processed food. If you're not conscious enough, it is very easy that you will succumb to this environment.
Oh, that's true. Yeah.
So, if you want to build a good child's health, you should be an example for your child.
Right.
And you should teach them that, all these are unhealthy foods. But doesn't mean that we're completely avoiding it. Look at me. I am eating this burger, but I am eating it once a month. Even though you eat multiple times, don't show that abuse. What a good child. These guys learn quickly.
Yeah.
You can't believe how many followers I have between this 9 to 12 years of age, where they come, they hug me, and then they say that because of you, I don't eat any ice cream.
Oh, sweet.
Okay, sometimes I feel like maybe I'm depriving that pleasure of the ice cream as well. But the other argument to that, they are so malleable that if you can instill what is good, what is bad. Bad means you shouldn't touch it at all. It's not like you shouldn't touch it at all. You can use it occasionally to satisfy your cravings, but you need to create a mindset where you balance the good food over bad food. That kind of mindset needs to be instigated right from childhood.
Okay. So now let's say somebody has been on this eating spree of unhealthy and junk food for the last 2 to 3 years. Is it reversible at this point of time? If yes, how long does it take?
So the gut bacteria, beautiful thing is it is malleable.
Okay.
It can be changed.
Okay.
And it takes you only 2 to 3 months.
Okay.
Okay, so I'll tell you a beautiful experiment that we did.
Yes, please.
Okay. To a point that how it can affect your personality. We had lab rats. Okay, so my job is to analyze the lab rats, mice and everything, and then see what kind of microbiome that they have. So we have 2 kinds of lab rats. One is a lab rat with a normal gut bacteria. Second is a lab rat which is microbiome free. It is a sterile lab rat. To create a sterile lab rat, you need to look at the environment. It is absolutely difficult to do that. To enter the lab, you need to wear as if you are a COVID patient or you are a doctor saying a COVID patient. You should be completely sterile. So you walk in and then, so that lab rat bacteria in the stool would be completely zero. There is no way. You remember I just told you that bacteria is just waiting to get into the village.
Yes.
So just to create that kind of a sterile environment is extremely difficult. But we do that to compare the effects of the gut bacteria. So we took the sterile rat and we took this rat with a normal gut bacteria. Okay. And we made them run in a open field. Okay. Do you think which bacteria, which rat do you think ran faster?
The sterile one?
The sterile one. Why is that?
Because it's healthy?
No, it doesn't have any fear.
Oh, okay.
Okay, it doesn't have any fear. If it was a normal rat, it shouldn't run fast in an open field where it get exposed to its predators like hawks or cats, or there should be some fear that he might be eaten up by something.
Yeah.
So normal rat was watching very slowly, cautiously in terms of, like what is happening. This microbiome free rat didn't have any fear at all. It just started running like crazy.
Wow.
Which means that the microbiome, the gut bacteria, modulates the fear mechanism as well, which is essential for the survival of the organism.
Right.
I'll tell you another mind-blowing normal mechanism that happens in cats and rats. Okay, there is a protozoa parasite called Toxoplasma. It's a parasite. What happens is the Toxoplasma parasite lives beautifully in cats. Okay, what this does is this gets into rats first. And when a rat is getting infected by this Toxoplasma, the gut bacteria of that rat is being modulated by this Toxoplasma, goes into the brain, and the fear response is gone. So the Toxoplasma makes the rat to be eaten up by the cat. So Toxoplasma gets into the cat and completes the life cycle.
Oh my God.
So that is how strong a mind can be modulated by
The gut bacteria.
And this has been proven in syphilis as well. Syphilis is a disease.
Okay.
It's caused by Treponema pallidum, which is an organism. That organism, when it goes inside the human body, it again transfers to your brain through this brain-gut axis, and it makes you create some mental health issues like anxiety, depression, and all the mental problems through the parasite-induced gut bacteria thing as well. So what I'm trying to say is this brain-gut axis is so strong
Yes.
that it is high time that we start respect it.
Absolutely. Because the experiments that you're talking about, it's like literally mind blowing, because then it makes us understand why certain days our mood is high, why certain days the mood is not that great, why do we feel like working energetically certain days. It's all connected to what we eat. So what do you recommend as the 5 best foods to improve the good gut bacteria?
Yeah. So as I said, it can be malleable. Okay. So it takes like 2 to 3 months. The key thing is it needs to be repetitive.
Okay.
Okay, you need to keep on training the gut bacteria that, okay, so this is what I'm feeding you. This is what I want you to feed me back. Okay, so into the top 5, I'm just going to say that every time you eat, you need to eat for 2 people. One is for you and the other one is for gut bacteria. So when you have a plate right in front of you, I want you to imagine that you are pregnant.
Okay.
Okay, you are eating for you. And you're also eating for the baby. That baby that you're feeding is your large gut bacteria.
Okay.
Okay. If it is pizza in front of you, you know that your baby is not getting food.
Wow. What an amazing way to start eating. This is crazy. Right.
Your baby is not getting food. Basically, you are killing the baby by making it starve.
Wow. Okay.
So, but don't worry, your baby is headmaster of the school that you did. You think you are a principal. It needs food. It will not die. It needs food. It came before you.
Correct.
Right? All your tricks will not fool that particular baby. It will need carbohydrate to survive.
Okay.
How will it get the carbohydrate? Because all the pizza that you're eating is getting absorbed in the small intestine itself.
Okay.
Nothing is going into the large intestine. Large intestine is where your babies are.
Okay.
So what it does, it starts eating up the carbohydrates of the lining of your large intestines. Basically, it's making a hole.
Oh, okay.
You are not feeding me, I will take my own food.
Okay.
And that's called mucin. That's a lining is called mucin. Mucin is very rich in carbs. So it starts eating. The more you eat pizza, the more deeper the hole gets. More you eat pizza, the hole gets even bigger. So when the hole gets even bigger, the tight Great Wall of China is being broken, which is the point of entry for all the invaders of toxins.
Oh God. Okay.
And that is where your immunity goes down. I'll tell you another beautiful example to understand this. This Great Wall of China, maybe China is not a good idea. But I'm just telling you an example because that's how long it is, how tight it is, that nothing can penetrate.
Okay.
Nothing can penetrate unless your own bacteria starts eating it up.
Right.
So we did research on monkeys, rhesus monkeys. Okay. Mother, baby monkey. We took the baby monkey out in a separate cage. It started feeling depressed a little bit. The activity was not that much. So we thought that, it was because of the separation. When you look at the stool microbiome, you will see the same amount of gut bacteria what you will see in an anxious patient.
Okay.
Okay, that was number one. Number two, these baby monkeys started to develop infections more than the baby monkeys who were with their mother.
Okay.
Okay, so when these baby monkeys, we were not sure why, what was happening, then you realize that this baby monkey is not having this bacteria called Bacteroides fragilis, which is a bacteria which is supposed to keep this great wall intact.
Okay.
So what has happened is, because the baby monkey has been moved out of the mother, the stress response has created. Because of the stress, the brain is activated. And because of the brain is not functioning well, the gut is also not functioning well. So the rate which the food is moving, the rate of acid secretion, all this gets altered. And when this gets altered, the immunity system, which is lining the GI tract, gets affected as well. The whole that I was mentioning starts to happen slowly.
Okay.
Which means the immune system is also not functioning properly. And that is why these baby monkeys were starting to have fever and a lot more infections than the baby monkey which was with the mother. So what it tells us is that the hole is the problem.
Okay.
It's like a big black hole. You want to make sure that it is not creating significant problems in your life by making it so tight.
Okay.
What can make this tight junction leak or wide open is stress. Is one of the major factors, and the food that you are eating.
So you said when the pizza goes in, the baby does not get food. So what other things can I put into my body that the baby feels nourished?
So the baby needs something called mac, not apple. Then you'll have to be really, really expensive baby. Mac is microbiota accessible carbohydrates.
Okay.
That pizza is a carbohydrate. Okay. But it is not accessible by your gut bacteria and large intestine because it's being absorbed as 40%. So you need to choose the carbohydrates that you can feed the gut bacteria in the large intestine. So examples include all your fruits and vegetables.
Okay.
So because they have complex fibers.
Okay.
And those cannot be digested by the stomach acid, digested by the small intestine. So it has to go into the large intestine, feeding the gut bacteria.
Okay. That is where the digestion of that happens.
That is where the shield around the complex carbohydrate is being broken in the large intestine, and microbiota feeds on this complex carbohydrates, releases a substrate called SCFA, short chain fatty acids, and this short chain fatty acids is the one which is making the gut lining strong.
Wow. I've really listened to a lot of people speak about this, but I've never understood it this well.
I'm sure you didn't understand either.
No, of course I did. It's the example that you gave where you're eating for two people. Yes, I've always been eating for two people, but I've been eating only for myself all these years. And also, this is very interesting. I want to talk about your own weight loss journey. You lost 35 kilos, right? How did you do that?
So I didn't understand all this gut bacteria thing at that time.
Okay.
But I could clearly see what has happened. Okay, so I was always in a very stressful environment. With the pressure to achieve.
Okay.
Okay. I think many of us can relate to the same thing where, you are in an environment where there is a you may not have a choice. You have to win, or you have to secure yourself in the spot. So that pressure to achieve will put you in a place where you will not prioritize your health.
Correct.
Which is very common.
Yes.
Young people, they always do that. So what has happened in my journey is that in medical college, I was in a lot of stress. Even before medical college, to get into medical college was a lot of stress.
Okay.
And after medical college, going into the US, Master of Public Health and all those things were like 15 years of stress of my body. So what has happened, I think, is that I had a very good gut bacteria while I was in Madurai, in my home, nothing mattered. So the stress started creeping in, and slowly that gut bacteria got changed. And the stress leading to the decrease in the good gut bacteria, increase in the bad gut bacteria, made me eat more with my food cravings.
Okay.
Right? And similar to the dopamine concept that we talked about. Then that made me gain even more weight. Then the bad gut bacteria was loving it. Because remember, I told you the gut bacteria can be changed in 3 months. I didn't change it for 15 years. It was having a party of their life.
Right.
Okay. So I can clearly see when I see a pizza, when I see a burger in the US, I just couldn't resist. Especially the Lay's chips, I just couldn't resist at all.
Okay.
And I was studying hard, and I was just telling myself that, okay, so I'm studying hard, I need this. You will not believe the meal that I used to have is, being a bachelor at that time, was very easy for me to do is have Maggi noodles. It's very easy. And curd rice with chicken nuggets.
Okay.
Which is very easily available in the US.
Yeah.
And tamarind paste.
Okay.
And if I have time, I'll have the white rice with the tamarind paste, chicken nuggets, and Lay's chips.
Okay.
Standard template for 2 years.
Okay.
2 years at night. In the afternoon, whatever I used to get. Okay, very easy. Snickers was one of my major thing. Again, high sugar and I think. So all this, I didn't even look outside of this food options at all. And now I know why. Because I was not able to.
Yeah.
My bad gut bacteria was controlling my mind in terms of what I have to.
So the cravings is also connected to the bad gut bacteria.
It does.
Okay.
It does. Because the same neurochemical dopamine, whenever I'm eating pizza, burger, it is being secreted. The gut bacteria becomes good or bad is based on what kind of chemical that it secretes.
Okay. Got it.
Right. So, in a normal patient, I told you 100 trillion gut bacteria, right? And it is multiplying 30 to 40 minutes every time. And it secretes toxins. Each and every time it multiplies, it secretes toxins. And even in a normal patient, what happens? The toxins is being excreted and detoxified by your liver and kidney. Okay. When I have a liver patient who has a cirrhosis because of alcohol or because of excessive food intake, liver doesn't work. One of the most common complaint of a patient with a liver disease is they will be confused. Most of the times. They will have brain fog, they will not remember what they are doing, and sometimes they will have seizures. We call this as hepatic encephalopathy, which means the liver is not working. Encephalopathy is that there is a problem with the brain where they are not able to put things together. And the reason that happens is because of these gut bacteria secreting toxins in the blood, liver is not in a position to detoxify it. It reaches the blood-brain barrier and it makes you do the way that you are supposed to.
Oh God.
Before the treatment of this is antibiotic.
Okay.
So we give antibiotic to destroy those bad gut bacteria.
Okay.
Correct? Before the invention of the antibiotic, what is the treatment?
What is?
They will remove the large intestine.
Oh, because the bad gut bacteria is there. Oh shit.
Surgical. That's good shit.
Oh my God. I mean, just trying to understand what's happening in the body in itself is both scary, and it is also giving so much insight into what all we should not be putting into the body.
Correct. Can you imagine removing a colon in a patient who is already having a liver failure because we are not able to control the toxins being produced by the liver, by the gut bacteria.
Bad gut bacteria. Oh God. Okay. So when you understood this, you've put on weight for bad eating habits, how did you reverse that?
So I tried multiple methods. I didn't know about all this gut bacteria at that time. So as usual, we went to gym, weight loss and everything. At that time, I got introduced to time-restricted feeding research in Stanford. I still remember the professor who called me and he said that, hey, you did research before on this. I don't, when I was working in Boston, in those 2 years while I was just putting all my effort, I did research on this time-restricted feeding at that time.
Okay.
I didn't even remember. So this professor called me later that I need some help. See, because you are a practicing gastroenterologist now, we want your patients' data. I said, yeah, of course. Why can't I? I'll give it to you. So the concept is that you can eat whatever you want between a particular period of time. Okay, preferably sunrise to sunset.
Okay.
Then you continue seeing these patients for like 2 to 3 months. The first thing that was very strikingly remarkable was the liver enzymes, which was abnormal in these patients with fatty liver, completely got normalized in 3 to 4 months.
When they ate in that window?
In that window.
Okay.
And they didn't even control for too much amount of calories.
Okay.
In my practical experience, I was like, wow, this is beautiful. They ate biryani, they ate pizza, they ate whatever you want. But they were very strict that they will not eat anything after sunset.
Okay.
And I said, wow, beautiful. So then what happened was these patients, when they actually ate really healthy in that window, they started losing weight as well.
Oh, okay.
I said, wow, beautiful. Then I started doing it by myself. Then I started losing weight. My family and friends were extremely supportive. With my knowledge, they didn't have any late night gathering at all.
Okay.
They've been having it without my knowledge.
I thought they stopped it. Okay.
Because it is very difficult to follow this method in this particular era.
Right.
Because most of the times it is late night gathering.
Yes.
Yeah. And we are underestimating the damage that we are doing with late night eating. Once or twice is good, but is okay. But that once or twice never happens. It is always on a daily basis. So I realized that, then I changed consciously in my routine about how do I change it, right? So initially it was like I used to eat at 10 p.m. before. Then I decreased to like 9:30, 9, 8:30, 8, 7:30. Then I realized that, okay, so 7:30 p.m. is a beautiful sweet spot for me, where I'm not feeling hungrier, I'm not feeling cranky, I'm able to do that, but that took some time.
Okay.
It took like 2 to 3 months for me to figure out. So while I did that, I started losing weight.
Okay, just by eating in that window and eating healthy.
Eating, initially it was not healthy.
Okay, it was just eating in that window.
Eating in that window. Then it turned out to be healthy.
Okay.
The mistake that I did was, I didn't know about all these protein, muscle mass and all those things at that time. So then I lost my muscle mass as well, whatever muscle I had.
Okay.
So now I know what the mistake I did. So I increased my protein intake, I did strength training, and I have regained a little bit of a muscle mass what I lost, but not to an extent that I wanted to. If I have to do this all over again, I will do within the window, within the correct amount of calories and macros in terms of a healthy environment, and also do strength training. If I do that, all three together, the outcome would be like significantly doubled.
Wow. What do you think is the biggest myth when it comes to weight loss?
People think it is gym.
Okay. So it's just 20% gym and 80% what we put into the body.
To be honest, if you walk into a gym without correcting your diet, it is just a waste of money to the gym.
Okay.
You could use that time, you could use that money to pre-plan your meals and make sure that you get that outcome rather than spending money on the gym. So take my example. No, I went to gym. In the US, where I was in Sacramento, California area. So I walked in and then they said it is $20 a month if you sign up for this gym. If you pay $40 a month, you can use any gym in the United States wherever you go. I said, dude, I will not even come to this gym. So I walked in and then I signed up for the personal trainer. Personal trainer, 1 hour is $60.
Oh, okay.
1 hour is $60. I was still in training at that time.
Okay.
Okay. At that time, training salary, it was a little bit expensive. $60 per month.
Got it.
But can you imagine $60 is how much is here? Like it's close to 5,000 rupees
Yes.
per hour.
Oh God. Okay.
Per hour.
Okay.
Okay. So I spent everything over there. I did for 3 months. And that trainer was very happy with me. I'm their best trainer. I'm the best client. Because I used to renew every 3 months and I will not show up. But when I did show up for like a month, nothing happened on my body. Because I didn't take care of my diet at all.
Got it.
Because I was so busy.
Got it.
You know, I was working in the hospital. I was doing this, and the gym, I was going just because that I signed up for it.
Okay.
Now, if I have to do this all over again, what I would have done is that, okay, so instead of spending like the 5,000 rupees per hour in the US, I would have gotten a chef.
Okay.
Or like a cook who can cook me proper home cooked good meals with fiber, feeding my babies, rather than spending that money over there. What is the ideal way? To do both together.
Okay.
But will you have time? Will you be individualized? That is why the decision has to be individualized based on your particular environment.
Got it. Got it. So you said complex carbs is very important for the good gut bacteria. So when it comes to extreme diets like keto, paleo or no-carb diet, what does it do to our gut?
It's a very controversial
question.
So keto doesn't have any carbs at all.
Yes.
But I just told you that the good gut bacteria
will eat
needs
on
carbs.
Yes, correct.
So there are multiple studies that shows that if you are on pure meat diet, your gut bacteria doesn't like it.
Okay.
It doesn't like it at all. Okay. And there is multiple studies showing that there's increased risk of heart disease if you are on a long-term ketogenic diet. And the reason being that is there is a chemical called TMAO, trimethylene amylin oxide. Okay. You remember I told you that every bacteria secretes a chemical.
Yes.
It secretes a chemical based on what it eats.
Okay, got it.
Okay. So let's say if you're eating a lot of meat, mostly red meat. If you eat a lot of meat, that particular bacteria eats the red meat and then releases this TMAO
into our bloodstream. Oh, okay.
And this TMAO is known to cause blood clots in the blood. So when your blood supply of the heart, because of this increased TMAO, there is multiple reports that says that, okay, so there is blood clots being formed in the circulation, decreasing the blood supply to the heart. And that is why there is an increased risk of heart disease among patients with long-term ketogenic diet.
Okay, got it.
Ketogenic diet.
Got it.
So that is why usually what I say is extremes will never work. Extremes will never work. And let's say that, if you eat a little bit of red meat here and there, will that cause any problem? Probably not.
Okay.
But the problem is when you're eating on a daily basis.
Okay.
The amount is also very high. And usually, most of the times, or you're veg or non-veg?
Non-vegetarian.
You're non-vegetarian. You're very proud about veg. Why? Non-veg. You're asking me how dare you can ask a question.
I think all of us know except for Anusha. She's a vegetarian here. Yeah.
Okay, you're non-vegetarian.
Yes.
Okay, you tell me when you're going to a restaurant, what do you order? No judgment, nothing. I also order everything. I just think from a common person. What do they order?
So when I go to a restaurant, I order a chicken or
Let's ask you, what do your husband order? Then you can say,
he orders what I want to order. So I order a chicken or a mutton starter. Then it's probably a biryani.
Biryani.
Yeah. And then some...
And then a dessert.
No, and a soft drink also.
Soft drink.
Yes.
Which is very normal.
Yeah.
And then usually, I was very surprised that usually, restaurant people are very nice. They take the decision making out of you.
They give it as a combo. Yeah.
They give biryani. They also have badam halwa right next to
Yes,
it.
correct.
Bread halwa,
correct.
badam halwa, something like that.
And they also give...
Carrot halwa, I'm sorry.
No, they give bread halwa.
Bread halwa.
Bread halwa. Yeah.
Bread halwa.
Yes.
Exactly.
Yes.
Because they don't want you to make a decision of what dessert I need to order. I'll give it to you.
Yes.
Okay. All right. So you tell me in this one, let's say that you listen to this podcast. Okay. And then you know that, okay, the fiber is very important. That's why you need to feed the babies. In whatever you told me, there is no fiber at all.
Correct.
Okay. And we know that. Non-veg doesn't have any fiber. Ideal thing to do is that, okay, so I'm eating non-veg. I'm not feeding my babies. You need to feed your babies, right? How do you feed? You need to eat more.
Correct.
How much will you be able to eat after this?
Not much.
Not much at all.
Yes, correct.
Yeah, especially if you're eating for lunch, you'll be feeling so tired that you'll have a good nap.
Yes.
Correct? So 2-3 hours later, you wake up, you drink coffee or something, And then at night, you will not feel hungry that much at all. Even if you want to eat cucumber, carrot, salad and everything, how much will you eat?
Yes, correct.
And you know how much you need? You need 25 grams of fiber per day.
Okay.
Okay? 100 grams of cucumber. How much fiber you guess?
100 grams of cucumber. 20, 30? No.
Milligrams.
How much does it have?
It's usually 2 to 3 grams of fiber. That's it.
In 100 grams.
100 grams.
I need to eat 1 kg of cucumber to get 25 grams of fiber.
Exactly.
Oh God. Okay. Okay.
Right. So fiber is not easy to get unless in non-vegetarians it's even difficult to get. So the angle behind this is that for each bite of your chicken, you bite a cucumber as well.
So I'm feeding myself, I'm feeding the baby also.
This one baby will eat you up. Have you seen Game of Thrones?
Yes, I have.
You seen the Dothraki Queen?
Yeah.
The dragon is inside.
So is there also a procedure to eat? Like you eat fiber first, protein next, and then carbs third. Does it work on our body?
It does.
It does.
It
Okay.
does. Definitely does. It doesn't work in the way that this glucose goddess is saying that, your glycemic index is going down. It is not working in that way.
Okay.
It is working because the protein creates a stimulation of the satiety hormone,
Okay.
where it is completely satiating for you. Which means when you eat protein first, you will not feel that much hungry. Second, fiber. When you have fiber, imagine your stomach is an empty balloon. Okay. Yeah, and then you are putting stuff inside. Okay. Let's say that you have fiber. Fiber will inflate by itself to a point that it completely fills 50% of the balloon.
Oh, okay. Got it. Got it.
Okay, so you only have space for 50%.
Got it.
So you will not eat that much.
Okay.
So that is the angle that this method works.
Okay.
All these glycemic index, having a CGM, showing you that, this thing like spikes your insulin levels, it is not good for you. I saw a reel where my favorite idli was being portrayed as it increases your glycemic index.
Okay.
It is supposed to increase your glycemic index. It is a carb. What do you think it will happen?
Right.
The idea behind that is not to look into that glycemic index levels. It is depending upon how good your insulin quality is to control that glycemic index.
Right. Right.
So what will happen is when you eat idli, you will have a lot of fermentation, short chain fatty acid that goes in, which will help you improve the quality of the insulin to control this glycemic index spikes.
Okay.
So blaming one food for increasing the glycemic index will never work.
Okay.
Will never work. So eating your protein first, fiber first, and then the carbs is not because of the glycemic index controlling. It's because of decreasing the satiety because of these two effects.
Okay. That's crazy. And recently I saw 2 very contradicting articles. The first article said breakfast is the most important meal of your day was actually a propaganda by cornflakes in the 70s. And the second one saying if you don't skip your breakfast, then your chances of getting a heart disease is kind of lower. So both of it is very contradictory. And Ayurveda says eat during when there is light, eat only during that time. What do we follow?
Yeah. So people think that I'm against Ayurveda. This is one of the principles that I follow.
Yes.
Like eat during light.
Yes.
So that is kind of proven where, your digestive hormones are very active during the day.
Right.
Similar to how you go to bed at night or
Correct.
digestive hormones go to bed at night. So you don't want to disturb them. So that is a pretty normal thing. Whether we're eating breakfast or not, there are multiple studies that say that if you skip breakfast, there is increased risk of heart disease.
Correct.
There is also there. And there's a propaganda that, breakfast should be your first meal.
Yeah.
But what I used to tell my patients is that, nutrition is such a vast topic that you cannot generalize.
Okay.
Or you cannot say that, one size fits all. It can never be like that. So what I tell my patients is, they're asking me, you stop eating by like 8 p.m. When should I have the next
Meal.
Correct? I say that you should not have any meal for 12 hours.
Okay. 12 hours. Okay.
That is a given. Because you need 12 hours to repair your gut lining. Every time you eat, you damage your gut 10%.
Oh, okay.
And if you eat ultra-processed food, you're damaging even more.
Okay.
And our gut lining has stem cells. And these stem cells would repair your gut lining every day
When we sleep.
when we sleep.
Okay.
Remember the deeper hole that we talked about? When you don't sleep, the repair is not happening, and that's where the gut lining is not that tight. So that is why sleep is also important. Coming back to what we have discussed.
Breakfast. So we give a minimum of 12 hours.
Minimum of 12 hours, okay? 8 a.m. to 8 p.m. Okay. So now, many people will be very hungry in the morning at 7 a.m. No, I shouldn't say many people. Few people will be very hungry. They will be waiting for the time to hit 8 a.m. and then they will eat. But majority, they will not feel hungry at all.
Correct.
Majority. They will start to feel hungry only at 9 a.m., 10 a.m. So that is where you should start eating. If you are a person, you can extend your fasting to like 11 a.m., 12 p.m. without any problem. Please do it. You just listen to your body. All you need to make sure that even if you eat 2 meals a day, you want to make sure that your macros are good, which is 1 gram per kilogram of protein per day, 25 grams of fiber per day, and then your carbohydrate should be whole foods, not ultra processed, and then get healthy fats. So this macro distribution, if you can make sure that you can get it within 2 meals a day, well and good. You don't really have to have a breakfast.
So fasting definitely has an impact on weight loss. But does fasting also have an impact on killing the cancer cells?
On laboratory research, yes.
Okay.
Yes. But many people think that, sugar causes cancer.
Yes.
When you go sugar-free, cancer cells will get better. That is not clinically proven.
Okay.
Proven. But theoretically, and also in lab studies, fasting has been shown to increase the repair mechanism of the body.
Okay.
That will also include controlling of the precancerous cells.
Oh, okay.
So I have this philosophical belief of that, every religion has fasting.
Yes.
Correct? So Hindus have Shashti.
Yes.
Christians have Lent. Muslims have
Ramzan.
So there is a reason behind that fasting has been incorporated in our culture. So I always say that we're all divided by religions, united by fasting.
That's so true. That's true. So I'm sure you've also seen this. Vidya Balan speaking about the anti-inflammatory diet, and it just blew up. So first of all, for a regular person who does not understand what is inflammation?
So inflammation is a common word that is being used when somebody is not feeling well. Before they used to say, what do they say? When somebody is not feeling well, they used to say, I'm not feeling well. Now they say, I'm depressed.
Oh, direct depressed.
I'm depressed.
Any small inconvenience, they're depressed.
Don't bother me. I'm really depressed today.
Yeah,
right. So similar to that, I think this inflammation word has been used very commonly.
And abused also.
Abused as well. So what does inflammation means is that, there is some kind of cellular chemicals in your blood that your body doesn't like.
Okay.
So it's trying to get out of it. Okay. So it started to stimulate your immune system with all this inflammatory mediators. There are multiple, tumor necrosis factors, cytokines, interleukins. All these are immune mediators trying to control all these bad toxins in the blood so that you don't get sick, you don't get any disease or nothing like that. So that is the real inflammation. So remember we talked about the deep hole.
Yes.
When the deep hole happens, all these toxins can seep into your blood. And that triggers the pro-inflammatory mediators to protect you.
Oh, okay.
To protect you.
It's a protection mechanism.
Protection mechanism.
Okay.
It's a protection mechanism. But when it becomes bad, so your protective mechanism is not adequate.
Okay.
Or the damage is so
much. Yeah.
So that is where the pro-inflammatory mediators will create insulin resistance, where insulin is there, but it is not able to work.
Got it.
Because of this
inflammation. Okay.
And when you don't do this, it becomes a vicious cycle, and the hole gets deeper, the inflammatory mediators gets really big, and the insulin resistance gets really worse.
So what foods actually cause inflammation?
Anything that comes in a package.
Okay. And are there any food items that are actually anti-inflammatory?
You cannot you cannot pick an individual item and then say that okay, it is anti-inflammatory. right?
Okay.
So you can actually zoom out and then say, okay, so what controls the inflammation? Good gut bacteria. The gut bacteria in your body is the what is controlling you overall.
Correct. Mind, body,
Mind,
everything.
body, and also immunity and also chronic diseases. So if you feed them properly, nothing will happen. Okay, because it can control the inflammation. I have a strong belief that inflammation starts right at the gut lining.
Okay.
If we can make sure the gut lining is intact, then the inflammation will never happen.
True.
Inflammation will never happen. So for that, we need to feed the gut bacteria.
Bacteria. Okay.
What does the gut bacteria doesn't like? Ultra processed food, which comes in a package. So, but we are being surrounded by that. So again, coming back to the same discussion, like you have pizza, burgers, snacks, biscuits, carbonated beverages, all this will have damage on your gut bacteria slowly. Cumulative dosage is the poison.
Okay. Got it. So you were speaking about the toxins and how the liver is not able to detoxify it. There are so many videos that I see about people saying detox cleanse juice. Do they actually work?
No, they don't work.
Okay.
They don't work in the way that it's supposed to.
Okay.
Okay. So I did a reel as well that, these detox, cleansing, juice, all this will not have as significant impact as what you think. But at the same time, if you can find a way in your diet to increase your fiber intake to 25 grams of fiber per day for 3 months, that will be the actual detoxification that you actually need.
So the body naturally knows how to detox itself. You give it enough sleep and you also include enough fiber, then the process happens normally.
Right, sir.
So in this, what is the role of water?
Significant.
Okay.
Because all the digestive hormones require hydration.
All the?
Digestive hormones
Okay.
require hydration.
Okay.
And one of the most simpler thing that we can do is just give water. Just give water. If you don't have water, then these hormones, they don't work
Okay.
properly.
Okay.
And then again, it starts a vicious cycle. In my experience, many patients' average intake of water is only 1 liter of water per day.
That's true. Yes.
Average intake.
Yes.
So people should be conscious to increase the water intake to a minimum of like 2 liters of water per day.
Okay. Got it. Other than that, just like how inflammation is something that people keep talking about, there's a lot of bloating that is there with people. Is it again a reminder from the body to tell us something is not okay in the gut?
Yes, of course. Bloating is the number one sign that is telling you that your gut is not good.
Okay.
When you're eating something, you feel really full. That is a sign to tell you that please reevaluate your dietary habits.
Okay. So what causes bloating?
It's either you are very sensitive to the food that you're eating or you don't have the gut bacteria to digest that particular food.
Okay, got it.
So, it releases gases like, hydrogen, carbon dioxide, methane, and all those things will inflate the intestines. And that is where the bloating happens.
Okay, so if bloating is an indicator, does farting also say something about a gut health?
Yes. Bloating, flatulence, and abdominal pain, abdominal cramping, and abdominal distension. All this is a sign that the gut health is not working properly. But normally, few people will have a flatulence. It depends upon how severe it is.
Okay.
To a point, what I tell my patient is that if the flatulence is compromising your quality of life, then it is a problem.
Okay.
I have CEOs coming to me and telling that, I'm giving a presentation.
Okay.
I have to leave the presentation, go to the restroom, have that flatulence, and then come back. It's that bad. I'm not able to control.
Okay.
That is a big problem.
Okay. So if it actually affects our life in general, then it is a problem. Otherwise, it's very normal.
Normally, flatulence is also it's a normal gastric motility, so it can happen as well.
Okay. Got it. Done. So there's another study that I read recently which said they've started to detect microplastics in the tissues of human body. One, where is it coming from? And two, when we order so much from restaurants and they put all this hot food in plastics, what impact does that have on our hormones?
Yeah. So there was the study said that microplastics was determined in the blood at a much higher level in patients who are having stroke-like symptoms.
Okay.
With a decreased blood supply to the brain. So there were blood clots in the artery that goes into the brain. It's called carotid. So people who had this carotid artery blood clots have increased level of microplastics in the blood. After adjusting for all the variables, which means that so there is some kind of connection. Okay. So what this does is we know that there is some kind of connection between plastics and the blood clots. So let's say you go to a restaurant, and here in Chennai they always give that in this hot,
Correct.
right? Hot thing in a plastic
Yes.
plastic bag. I had a subscriber who took a picture of it, and he said that because of you, I'm not eating this at all.
Okay.
And then after sending it, he ate it.
Okay.
But the point is that one-time exposure of the microplastics, is that going to cause you a problem? No.
Okay.
Okay. It is an accumulated dosage. Then you need to figure out what are all the ways that we are getting exposed to microplastics on a daily basis. Only then you'll be able to know how do we cut down on it.
Correct.
So plastic spoons, plastic plates, plastic bowls. And in general, what we recommend is to decrease all these plastic exposure as much as possible. What we can do from a household standpoint is that converting all these plastics container to either a stainless steel spoon or a glass.
Okay.
That is something that we have done at our home as well. But if I go to a restaurant and if I see a hot plastic bag with the food inside, will I say no? Probably not.
Okay.
It's okay.
Okay. Good.
Yeah. So that is where the fear mongering comes, where, you shouldn't even eat this. But the bigger picture is being missed.
Okay. So when you avoid all these small things on a regular basis, you reduce the impact that it actually has on your body.
Correct.
Right. Okay. Got it. So now, I mean, this is something I've been wanting to ask you. It's more like a personal question. I think the last 6-7 months has been hectic when it comes to work. Though the work is so inspiring, it's amazing. One thing what we've started to notice is the sleep patterns and the reduction in the number of hours I used to sleep previously. So what happens to the body if you sleep for less than 7 hours?
So you're sleeping less than 7 hours.
Yeah.
So sleep is one of the most underrated thing.
Okay.
So I feel bad when people are like spending this 1 lakh rupees, 2 lakh rupees on this treadmill and on this like huge investment on physical activity where they don't get enough sleep at all. Then there is no point in doing what you're doing. Most of my patients, when they come with IBS symptoms, the first thing that I ask is, how long do you sleep? And they say, 6 hours. I say, go and sleep for 7 hours and then you come back later. They will never come back. Either they couldn't sleep for 7 hours or they found a better gastroenterologist.
Or their problem was solved.
Problem will never solve.
Okay.
If the sleep is less than 7 hours, problem will never solve. I'll guarantee you that.
Okay.
Because the brain gut axis is being very disturbed. So we just talked about how important the gut bacteria is.
Yes.
And we talked about how strong the brain gut axis is.
Yes.
This brain gut axis is requiring you to sleep for 7 hours.
Okay. Minimum 7 hours. Okay.
Minimum 7 hours. If you're not doing that, then you are again compromising on this brain gut thing. There are few people who will say, I sleep only for 4 hours, 5 hours, and then I do get better. There is only the percentage is very minimum. So majority of us will need a minimum of 7 hours of good quality sleep.
Right. So generally when people work out in the gym and they also exercise regularly, they're able to reduce a lot of weight except for the belly fat.
Yeah.
What is the reason for the belly fat to not reduce?
So, we as an Indian community, we are genetically, we have a manufacturing defect.
Okay.
Right? Any calorie that is more than what is needed, it goes and directly gets settled in our abdomen.
Okay.
That is not common in US people.
Okay.
It is an ethnically genetic defect that has been proven in Southeast Asian population.
Okay. Got it. Okay.
In fact, we have a study called Masala study
Okay.
in the US.
Okay.
Examining why these people are at increased risk of heart disease, diabetes, hypertension of the Southeast Asians.
Okay.
Study. So if you look at it, everybody have this speed breaker in the middle.
Right.
Right? So that is a genetic component. So for example, if you take like a 35-year-old white guy, if he eats pizza, burger, nachos, french fries and all those things, he will become obese throughout.
Okay.
In our case, majority of them will become skinny fat, where you look skinny outside, but you are fat inside.
Okay.
We call this as TOFI.
Okay.
Thin on the outside, fat on the inside.
Oh, okay. So it's common with South Asian people.
It's very common. And I think it's very common in Tamil people. More.
Why?
It's because of our rich carb consumption throughout. But before, carb consumption was equally negotiated by the physical activity. But now the carb is going up, physical activity is going down. So now it's a recipe for disaster.
Okay. So when we start to take care of our gut health, right, okay, I would reframe it. What amount of alcohol is okay?
No amount of alcohol.
Okay.
Look at that depression in her face.
I don't drink. For the records, I don't drink.
She's saying, close the podcast. Adhe ni kek. She's like,
yes, for all the viewers, I don't drink.
So no. I think it's a very common question. I'm not saying you're drinking. It's just that even a single drop of alcohol will kill some amount of gut bacteria.
Okay. Oh.
It depends upon how much you're taking, how much of the gut bacteria. It's all individual. So no amount of alcohol is safe. Before, they used to say that in fact, we have in our gastroenterological clinic, we see fatty liver patients. So they say that, alcohol use, now it is getting more common here in India. In the US, it has been always common. They always drink wine after dinner. How we eat kadala mittai after dinner? Our kadala mittai is a wine.
Okay.
Every household will drink wine.
Okay.
Right after dinner.
Okay.
And they'll just get bottles and bottles of wines. And the first question is that, okay, fatty liver, how much amount of alcohol you drink? You shouldn't drink at all. That's not possible. So before, we used to say there was a safe limit of alcohol where if it goes beyond that, it has significant damage. But that doesn't mean that the safe limit itself is without any damage.
Okay, got it.
Right? So we used to say 5 ounces of wine. So it's 150 ml. And 1.5 ounce of liquor, which is like 45 ml of liquor. And then 12 ounce of beer, which is like 1 beer bottle. Okay. Now we have learned that even the safe limits have significant amount of damage in the gut bacteria. Then we don't recommend any alcohol at all.
Okay.
So that is the real truth.
Okay.
So how are we trying to compensate with that in this, socially demanding environment?
That's true. Yeah.
It's a question for you to answer. Okay, for not hers. for you to answer, because you need to understand. Okay, so this is almost similar to a patient working a night shift.
Okay, correct.
Okay, so you know that you are damaging your body. What are all the other things that you are doing to protect the damage?
Okay.
That is what you should think at. So as a society, we should label alcohol as a strict no-no for social drinking.
Okay.
Okay, so we should not labelize social drinking as a normal habit.
Yeah, it's become so cool these days. Like if you don't drink in a party, people look at you as like, what's wrong with you?
Correct.
And what's your view on all these people having 2 a.m. biryani, 3 a.m. biryani? Have you gone to those streets in Annanagar and Mount Road?
Yeah. So I went there once actually to take a video. I put a video.
Yes, as an experiment. Yes.
So I went a video. One guy was eating the biryani right next to the street vendor. He looked at me and he told me,
I know why. I know why.
And then he didn't even put his mouth. So you remember I told you that, every time you eat,
Yes.
you're damaging the gut cells.
Gut. Yeah.
And the gut cells needs repair. And the repair needs
Sleep.
And the sleep needs 7 hours. And the rest needs 12 hours. You eat 2 a.m. and then biryani. When is all this happening? Right?
It's correct. Yeah.
So what is happening is you are creating a hole in the gut, almost similar to the size of the biryani plate.
No wonder that person was scared of you. I mean, I was telling you exactly what we did in office. We got to know you're coming. We put all the snacks in a cupboard and made sure that you're not seeing any of the snacks.
They put do not touch. But doesn't mean that, you're eating like one night 2 a.m. biryani. See, again, that's why I say that, people think that I'm always against all this. Not true.
No, yes.
Not true.
Yeah.
It is always the accumulated dosage.
Got it.
So that's why I feel really bad for the night shift people, because accumulated dosage is getting more common and more frequent in them.
Right. And you were speaking about how when a child is born, through the vaginal bacteria, there's a lot of good bacteria that goes in. What happens when there's a C-section?
C-section, they are not getting exposed to the good bacteria, but doesn't mean that they should be worried about it.
Okay.
Like if you supplement with breastfeeding, breastfeeding itself will promote good gut bacteria, because a colostrum in the breast milk is one of the most successful real estate that you could give for your good gut bacteria.
Okay. So for a mother, now I want to understand, for example, let's say if somebody is planning their pregnancy, both the mother's immunity and the father's immunity is extremely important for the child to have a good health. But how many months before should the mother start prepping herself or start eating really healthy for her too?
3 to 6 months.
3 to 6 months.
Yeah, you remember, I told you that the malleable time is usually 3 months.
Okay.
3 to 6 months.
Okay.
So even if you are, and also people need to understand, every pregnancy is not a successful outcome.
Okay.
You need to understand.
Yes.
10 to 20% will not result in a good pregnancy. Maybe, I'm not sure the exact percentage, but quite a bit will not. The successful outcome is based on the health of the
Mother.
Not only on the mother's baby, even before it conceived.
Oh, okay. Got it. I got it. Yes. Okay.
Right? So if somebody wants to conceive, the best thing that they can do is to take care of their gut health 6 months prior. The journey would be beautiful.
Okay. What are the best 3 things that they can include in their diet?
Every meal, they should have 1 vegetable and 1 fruit.
Okay.
And number 2, they have to have 1 fermented food every day. And number 3 is that if they look into any snacks, they should just, if they look into any packaged snacks, they should just run away. If they are serious about it. But if they have time, because I'm eating one now, and maybe, I can compensate later, then that's a different story.
Right. So now when you speak about vegetables and fruits, people talk about how much they're covered with pesticides these days. What is the best way of washing it?
So I'm not a big fan of looking into the pesticide that much.
Okay.
Because I always feel that, if you're sleeping for 5 hours, that is the most important pesticide that right there, that you need to delete it.
Right.
Rather than washing the food. So in general, I don't focus on all these minor things.
Okay.
All right, drinking green tea, washing focusing on the pesticide content, choosing organic. All this will help if you take care of it, provided the major points are taken care of.
Okay, got it.
But if you want to know about the pesticides thing, then simple washing of all the vegetables is one of the most important things you could do. And if you're doing a meat thing, we usually separate meat cutting table from a vegetable cutting table.
Okay, got it. So I remember when I was in college, that is the first time, up until then, I was at home. My mom used to give me all very, very healthy, nutritious food. When I went into college, I got exposed to this new food called Parotta. That was the first time I got exposed, and I was like, oh my God, this is so good. And I ended up eating the 3 meals a day, and I had major constipation issues. With that, I started to realize how I had a lot of skin issues also with constipation. How is this connected?
It's not connected with the constipation. It's connected with your gut-skin axis.
Okay.
So first, Parotta causing constipation is not a surprise.
Correct.
It's a surprise only to the Parotta person who's selling to you. Because it doesn't have any fiber at all.
Yes.
And we talked about it where if you have Parotta, it's maida, it's filling. And you eat more Parotta because, that's what the substance is
The
designed to
dopamine,
do,
yes, correct.
right? Designed to do. Then you don't have enough space for anything else to fill the fiber. So parotta without any fiber is a recipe for constipation. Okay, and when you are when you're doing this, you are depleting the food for the good gut bacteria. So what happens is that our gut is called a second brain because it is surrounded by nerves called enteric nervous system. Similar to our CNS, central nervous system, it's called ENS, enteric nervous system. If this has like trillions of neurons, this has like billions of neurons.
Oh, okay.
Okay, it is almost as powerful as your first brain. To a point, even if you don't have a brain and spinal cord, it can still work.
Okay.
So that's how powerful it is.
Okay.
And this is where every signal is going from the gut, which is including the signal to your skin. So there is an axis called gut-skin axis.
Okay.
Similar to the bacteria in the intestine, there is a huge number of bacteria in the skin as well. The skin is the largest organ. So lots of bacteria is there on the skin as well. So when this connection is going down, this good bacteria, the skin also
Goes down.
And that is where your acne and everything will.
Literally every single function of the body and the mind is connected to how good a gut bacteria is.
That's why my podcast is called Gut Feeling.
That's why your videos are also just so informative. So next question is dairy consumption actually bad for us?
No.
It's not.
Yeah. So if you are not having abdominal bloating, flatulence, discomfort, pain, cramping after drinking a dairy product, majority of them can drink like 1 to 2 cups of milk.
Okay, there's no problem with that. Why is that all of a sudden in the last few years, all these terms that say lactose intolerant, gluten intolerance has become so prevalent right now?
So that's why lactose intolerance, you need an enzyme called lactase. And that lactase will go down every decade. Luckily for Indians, we have evolved in a way that this lactase enzyme is persistent even 40-50 years of age.
Oh.
In US, it's very common. They cannot drink milk after 25 years of age. But even if you look at our party, they will drink coffee even now.
Yes.
Because they've evolved in a way that we're able to digest a little bit more. But now, because of all the other changes we talked about, the lactase enzyme also have got it. Right?
Okay.
So in Indian people, usually we see this lactose intolerance kicking in after 25, 27 years of age. So if you don't have that, then it is okay to drink the milk.
Okay.
And the reason for all these intolerances is again the basic disturbance in the brain gut axis.
Okay.
So intolerance is different from actual allergy.
Okay.
So intolerance is you are sensitive to that ingredient.
Okay.
Actual allergy is the real problem.
Okay.
So for example, gluten actual allergy is called celiac disease, where your body's immune cells are thinking that your intestine doesn't belong to you. So it starts to eat up the proximal part of your small intestine where your wheat is getting absorbed.
Okay.
So that is the real disease.
When it is allergy.
It's called celiac disease. We call it an autoimmune disease because it's an autoimmunity. Your immune system itself thinks that your body doesn't need it.
Okay. Okay.
That is a real problem. The insensitivity, the sensitivity or the gluten intolerance, it's different.
Okay.
Different in a way because your brain gut axis is not working properly. Even roti, general bread, you will not be able to digest that much because the connection is not.
Okay, got it. So what happens to our glucose level when we drink juices or smoothies or coffee?
So when you drink juices, what happens is, it's all, for example, one juice, to get a glass full of juice, you will have at least like 3 or 4 fruits.
Yes, correct.
That goes inside, right? And fruits has fructose. And fructose is not natural. Fructose from natural fruits is not bad. Fructose from the artificial processed food is bad. Okay. But invariably, fructose goes to your liver. Liver is the only way that can metabolize fructose. The problem with juices is that if you are having a decompensated insulin resistance, where your insulin is not working properly, or you have maybe like a mild fatty liver, or you are a little bit obese, what happens is that the fructose metabolic capacity goes down significantly in the liver. So when you are drinking like 3 or 4 fruits inside a juice, the load of fructose is too much for the liver.
Okay.
That's one problem. Second problem is there is no fiber at all. When you are drinking, again, you are not feeding your babies.
That's correct. Okay. What is the best health advice that you've ever heard from somebody?
So I also say that, but one person told me is that there is no one single superfood or there is no one single bad food.
Okay.
That clearly tells that is consistent with the amount of knowledge what we have.
Yeah. It's always been that way.
It's always been that way.
Okay.
So, like, don't eat this. This is really bad. That may not be true if it is just used like occasional.
Got it.
So one, for example, eat this biscuit, you are going to die. That is not going.
Not true. Right. So people with fatty liver, what are the 3 foods they should avoid?
Same thing. Ultra processed foods. In any packaged foods is the main problem. And usually fatty liver will have the main problem of fatty liver is obesity. It's not that there is a problem with the fat. Second is alcohol. You should completely avoid alcohol. The third thing is they need to focus on 10% of weight loss.
Okay.
In 3 to 6 months.
Okay. Got it. So coming to the last section, I'm going to ask you a bunch of questions. You just have to say if it is truth or if it is a myth. Okay. The first one, eating spicy food causes stomach ulcers.
No.
Okay. Diet Coke is better than regular Coke.
No.
Okay. Plant-based diet is the best for gut health.
Yes.
You can heal your gut by just taking supplements.
Good.
Rice makes you fat.
No.
Drinking apple cider vinegar before a meal can reduce sugar spike.
Yes, but it may not be effective in that particular patient.
Okay. Ghee is better than vegetable oil.
Yes, slightly, because it has healthy fats. Yeah.
Okay. Eating too fast can lead to more gas and bloating.
No. Eating too fast, actually, when you eat fast, you'll swallow the air.
Okay.
Okay, and then goes in the stomach. And belching will happen.
Wine is good for gut and skin.
No. It.
All right. I really think of all the podcasts that we have done, this is one of the most fun and definitely super informative. I mean, I'm sure everybody is going to gain a lot of insights from this. But personally, me and my team are going to make decisions in our office to remove all the food items that don't feed the little baby inside of us, right? Thank you so much, Dr. Paul, for doing this. I'm sure this is going to inspire and help a lot of people make proper decisions with respect to their lifestyle so that they can lead a very holistic and a happy life. Thank you for doing this.
Oh, thank you for having me. I had a blast. Thank you.
Thank you so much. I think this is a great podcast.